Hi everyone, this is Mohit. Uh, can you hear me?
Yes,
Perfect.
Moise.
Thanks for the confirmation.
Mohit, do you want me to help you with the deck or you'll be taking it?
Now I'll be taking it. Um, sec.
Okay.
Perfect. We'll be going live in 2 minutes, right? I'm assuming.
And Mohit, will you be sending out a link to the recording of this afterwards for us to promote on LinkedIn or anything?
Yes, we'll do that. I'll share the link with you. Great. Is my screen visible? Perfect. Thank you so much, Dr. Ian, for the confirmation. Um, Great Learning team, can you hear me?
Yeah, Mohit, you're audible.
Yes, Mohit.
Great. Have we gone live or are we still waiting? Avish, Vanessa, can you please let me know if we are live or if we are still waiting?
We can go live. We can go live.
Perfect. Perfect. Good evening, everyone. Thank you so much for joining in for today's webinar. I welcome you all, and we'll probably wait for another minute or two as most of you are still joining in, and we'll start off in a minute. I see a couple of participants already here, so we'll just wait for another minute, and we'll start off. Great. So we'll start now. A very good morning to you all. For those of you who are joining us from US, good afternoon and good evening to folks joining us from other countries. We welcome you all to today's webinar, where we will discuss about one of the newest programs from Johns Hopkins Whiting School of Engineering, AI in Healthcare. And we're excited to talk more about the program, what it entails, who is it for, what will the program structure. You will hear from the faculty themselves, and so that you get a better understanding of what this program is all about. Is it the right fit for you, and what to expect as you look at exploring this program and potentially enrolling into this. So with that, we'll kick off the session. Let me quickly introduce myself. Uh, One sec. I think, yeah, I'll just share my screen once again. Yeah. So my name is Mohit. I'm a part of the Great Learning team. I work with new program development and so I look at new program development and delivery for various technology programs here at Great Learning. I have more than 10 plus years of experience in technology and education consulting, and have in my past life worked as a strategy consultant, worked across multiple engagements in US, Europe, India, Middle East, Singapore, covering a wide range of education verticals. And I was working with EY Parthenon's education practice, which is India's leading education strategy consulting firm before I moved to Great Learning. And here, of course, I look at new program development and various new offerings that we bring for all of you. Uh, so today's quick agenda is, given we are looking at AI in healthcare and want to understand what the program is all about. Firstly, we will also want to understand what are the barriers to AI adoption in healthcare and how this program bridges the gap, because that's quite important to know. AI is nothing new, and uh, there have been multiple attempts of implementing AI in healthcare, and some of it has worked, some of it has not. And we'll hear from the faculty what's been the scenario so far, and how the program kind of bridges the gaps and kind of fills in everything to make sure that the candidates go out with a proper understanding of this field. We'll get to know more about Johns Hopkins University. Of course, it doesn't need much introduction, but we'll of course hear from the faculty in terms of what's happening at Johns Hopkins, what's happening in the field of AI, healthcare, and other areas which are super interesting and relevant for this program. We'll quickly talk about Great Learning, as Great Learning has partnered with Johns Hopkins to deliver this program. We learn from the faculty on who is this program for, who's the right audience, and if you are a part of that audience, then maybe the program would probably make sense for you, and then what to expect from the program, how the program is designed, what's the overall structure, how it goes from week by week, building upon different concepts, various layers, what are the key highlights, and what's the admission process for the program. Towards the end of the session, we'll also have live Q&A with the faculty. And in the meantime, if you have questions, you can post it in the Q&A window. So for all the participants, there's a Q&A window available, which you can use to post the questions during the webinar as well. And we'll answer those at respective points during the webinar. And of course, there's a detailed Q&A session at the end. So we'll take those questions there. With that out of the way, I would first like to introduce Dr. Ian McCullough. Dr. Ian McCullough, welcome to the webinar, Dr. Ian. It's a pleasure to have you here with us. Dr. Ian holds joint faculty appointments in public health and engineering at Johns Hopkins University, and serves as a manager of artificial intelligence, continuing and executive education. His research focuses on strategic influence in online networks and understanding of cognitive dimension of the information environment. Dr. McCullough is the author of 3 books and over 100 peer-reviewed papers, primarily in the area of social network analysis. He previously served as Chief Data Scientist and MD of AI at Accenture Federal Services. And before transitioning to academia and industry, he retired with a glorious career in the US Army after 20 years of service in special operations and counter improvised explosive device forensics and targeting. He holds a PhD and 3 master's degrees. And of course, one of the best faculties out there to learn from. So welcome, Dr. Ian, to the webinar. Pleasure to have you here.
Thank you for having me.
We also have Professor Daniel Byrne with us, who is another faculty, along with Dr. Ian, who will be navigating, with you all through this program. Both Dr. Ian and Professor Daniel are the key faculty members for the program. And Professor Daniel is an award-winning author, teacher, and faculty member at Johns Hopkins Whiting School of Engineering and the Department of Biostatistics at the Bloomberg School of Public Health. He has over 40 years of experience in artificial intelligence and predictive modeling for healthcare. His work focuses primarily on improving patient outcomes through AI driven solutions. His research highlights the use of pragmatic, patient level randomized controlled trials to enhance scientific rigor when comparing AI interventions to traditional care. Professor Byrne has published more than 165 scientific papers and authored two books. He holds a bachelor's degree in biology and computer science from the University at Albany, State University of New York, and a master's degree in biostatistics from the New York Medical College. Welcome, Professor Daniel Byrne, to the webinar. Pleasure to have you here and look forward to hearing from you.
Thank you.
Great. So with that, I will hand it over to Dr. Ian to help us all understand about more about AI, healthcare, and why does AI fail to reach its full potential when it comes to healthcare. Over to you, Dr. Ian.
Well, thank you very much, and it's great to be here with all of you. As Dan and I were talking, we were having a conversation a while back, and we were talking about the potential that AI has, the clear potential AI has to improve patient outcomes, to improve efficiency, to reduce costs, to have all of these benefits, right? And then we noticed that in actual practice, it doesn't get used anywhere near to its full potential. And so we began to start asking ourselves, why does AI not reach its full potential in healthcare as it might in some other industry, especially when arguably healthcare might have even a greater use for AI than a lot of industries. And so we've kind of identified three areas where we perceive problems occur in AI adoption and AI understanding that would actually take it to the next level, and some things that I think are unique in healthcare. The first one is this misalignment between clinical needs and AI solutions. So, there's a lot of tacit knowledge and understanding that goes on in healthcare that is difficult to communicate to somebody doing AI. And if you think about it at face value, the idea that somebody out of Silicon Valley, because they can code in Python and they can do some cool math, that they can replicate decades of medical training through medical school and hospital administration is absurd, right? If you think about it. A person that is a technologist coming into this, they can understand models, they can understand features, and these models and AI advances are incredibly powerful in healthcare and treating patients. But there is a certain knowledge of what features matter or what's important. I mean, if we just think about PubMed literature in the medical field, academic publications are less about facts and findings and more about debates and potential arguments. And so this is a problematic for a layman when they try and go onto a generative AI or an online solution to try and self-diagnose themselves, right? They're not going to appreciate those debates and those differences. Whereas a physician, because of the medical training they have, when the clinician is looking at those debates, they're able to appreciate the arguments and figure out what's unique about their patient, and they're able to make that tailored treatment for their patient that is more effective. That's the way we do medicine. That same level of engagement has to occur between the AI technologist and the clinician in order for you to get the maximum benefit, right? The technologist can get the data formatted and can get like a software platform and can get like steps 1 and 2, but you really need that collaboration to get the next mile and to actually make it useful. The second area that we find is problematic is poor test evaluation and a human baseline. And so a lot of times people substitute empirical data analysis for rigorous scientific trials. And because there's numbers and maybe there's some data, and because it's a little foreign, they think, oh, that's hard, that's rigorous, but it's not. In fact, I think Malcolm Gladwell's book Blink, it does a great job of showing that, sometimes experience and intuition is better than data analysis on a lot of applications. And I think we see that in medicine where, experienced physicians develop an intuition of what's wrong, and that tacit gut knowledge can sometimes be better than ill-informed, or the wrong kind of evidence-based medicine. And I know there's this debate between evidence-based medicine and intuition, and I don't think it's an either or. I think it's a both, right? I think that there is a value of that intuition. There's a value of evidence-based. But even when you're using evidence-based medicine, it's really good a lot of the times. Exploratory data is good for hypothesis generation. You then still have to follow the scientific process and do the randomized controlled trial or the test and evaluation so that you know that it's working. We also have this cultural bias where people are always going to be less distrustful of the AI and more trustful of the human. And they're going to be more forgiving of human error than they will of machine error. At least we see that in a lot of areas. And so we're oftentimes ignorant to the flaws of human processes. And there are certain areas, right? So we know, for example, that well-trained AI can identify potential pathology in imaging better than humans can in many cases, right? Or we know that there is optimism bias in selection of patients for organ transplant. We know that there are countless areas where humans might have bias or issues, and we never take the time to measure that, for a wide number of reasons. And so then we don't even think to start measuring until we implement an AI system. And now we're comparing the AI system against perfection. In many cases, the AI system can improve patient outcome, improve healthcare quality, remove some of the known issues with humans, but we've never even measured it. And so I think understanding test evaluation in the human baseline is another critical area for AI in healthcare. And then lastly, there is a lot of uncertainty evaluating the impact of these AI tools on patient outcomes. And a lot of times that can be because we are looking for the flashy, exciting AI application instead of one that is pragmatic at improving operations. A lot of times uses of AI for things like logistics planning and for scheduling and for insurance claims, right, can be very, very pragmatic and clearly move the return on investment, but they don't inspire people like improving organ utilization in organ transplant or reducing readmissions in the hospital or something like that. And so I think that the type of use case and the way we evaluate those use cases are important. And so we've really designed this class with these kind of three areas in mind, and I think that's what makes it very unique in the landscape of courses. A lot of other courses and programs, and even some of the other ones that we teach at Hopkins, are very much focused on, hey, here's a cool AI innovation, and here's how it improves this specific application in clinical care or in hospital administration or something like that. But it's not really looking at these broader strategic areas, and it doesn't do a more holistic look at AI and how AI can be applied to healthcare. And so I think that's what we have that's a little bit unique in this course. Mohit, let's go on to the next slide. So why Johns Hopkins? Hopefully it's a name that you've all heard of before. We are the #1 medical school. We are the #1 biostatistics department, the #1 school of nursing, #1 in biomedical engineering. We're #5 and I guess another #1 that I should point out there too is we are #1 in our online education for AI program. So that was new about a year ago. And #5 in global and clinical health subjects. We've risen to #6 in national university rankings. We've been in the top 10 as long as I've been in academia. Ranked globally #13. Michael Bloomberg has made some very generous donations to the university. One allows us to cover the full cost of medical tuition, which has really elevated as you can imagine, the student population that's trying to come to Hopkins, and so it's really kind of upped our game in even further. The $1.8 billion investment in our new data science and AI initiative is really hiring enough faculty to position Hopkins as the largest AI faculty in the world. And it also well, at least I know the statistic before the inauguration here in January. But as of, let's just say, the beginning of the year, Johns Hopkins is the largest research institution in the country, possibly in the world, with double the research volume of its next competitor. So we do quite a lot of research. And so I think that interdisciplinary programs and this interaction between top healthcare, top program in AI, focus on research really brings some unique experiences. And we were going to feature in this course a few different case studies that Dan and I have done, but then also we're going to feature a few from some of our colleagues as well. So we're really excited at bringing this to you. Next slide. And I'm going to pass this back over to Mohit to discuss great learning.
Sure. Thank you. Thank you so much.
I do just want to say real quick before I hand it over to you that I have to say that I have fully enjoyed our collaboration just from the Johns Hopkins side. I've been teaching higher education for well over 20 years. Dan has been doing it longer than me. And one of the things I have to say is true collaborators that are able to challenge us in our teaching, push limits, kick around ideas, add additional content, and it's a really great collaboration. I also think that they bring in industry mentors. So these are people that are actively working in industry in these spaces for weekend sessions. And I think that mix of learning modalities and experience, it really creates a very unique learning environment that I think is very difficult to find elsewhere. So with that, I'm going to hand it over to you, Mohit.
Thank you. Thank you so much, Dr. Ian, for the kind words and resounding testament of our collaboration. Thank you so much. So with that, I'll quickly before I get to great learning, I think Dr. Ian did a fantastic job of explaining how thoughtfully the program has been designed, keeping in mind the three pillars for ensuring that AI in healthcare is actually seen at it from different angles, ensuring testing eventually outcomes. So which makes this course a fairly comprehensively designed course from a strategic point of view, from an execution point of view, and we are sure that the candidates will find this course very engaging and helpful. With that, I'll also want to talk quickly about great learning. So we've been in the online learning space for more than 11 years now. We have almost 12 million plus registered learners across 170 plus countries, and we've already delivered more than 440 million learning hours over the last 11 years of our existence. We have more than 3,400 corporate partners, and we continue to get very high learner ratings, 4.5 out of 5. And as Dr. Ian mentioned, we collaborate with more than 7,700 industry mentors. And the only objective and the agenda that we seek is enabling career success through transformational learning experiences that we deliver to our learners in collaboration with some of the world's best universities. We have programs from Johns Hopkins, of course, from MIT, and Harvard Medical, Duke, etc. And our constant motive is to ensure that we deliver one of the best learning experiences to all the learners. And with Johns Hopkins, of course, we manage the entire admission process. So for those of you who are interested in knowing more about the program, you'll probably get in touch with the Great Learning team who can help you, get more details about the program. And then eventually, once you join, we look at the program management and delivery part. So the program managers will be assigned to you respectively as you go through the program, and they help you during the journey. And we also, of course, provide student support on behalf of Johns Hopkins to all the learners in this program. So that's the role, and we are super fortunate and super lucky to be working with Johns Hopkins, as a collaborator with this program, and look forward to having to bring to creating a wonderful learning experience for all of you. With that, I will hand it over to Professor Byrne to talk about who is this program for and who's the right audience who should be looking at enrolling in this program and what they can expect to learn from this. Over to you, Professor Byrne.
Thank you so much. So Ian and I talked about how there's great interest in AI and there's a lot of investments, but there's also going to be a shakeup, and there's a fork in the road, and there are going to be people who are winners and people who are losers. And the people who continue with hype and false claims and weak evaluations are not going to be the ones who are successful. The ones who are going to be successful at using AI in healthcare to improve patient outcomes are the ones who face the facts and do rigorous science. And we have years of experience doing this, and we'll help you learn how to do that. We also understand three things: the big picture, the technical details, and how healthcare works. And it's essential to learn those skills in order to use AI in healthcare effectively. So we have a set of instructions here that will teach you the precise skills you need to be successful at using AI in healthcare. I have a track record of successfully building, implementing, and evaluating AI tools in a healthcare setting. And a lot of our case studies will be based on that experience. So we've built AI tools to predict postpartum hemorrhage and blood clots in children and hospital readmissions. And it's easy to build these tools that predict these things, but it's a completely different matter to evaluate them, validate them, implement them, encode them into the EHR, and then know if you're moving the needle and improving patient outcomes. And I think the people who are going to be successful in the future are going to have a set of skills from multiple fields, and they're going to need to know the things that we teach in this course. So who's this course for? So it's for a variety of people. It's for people who are interested in AI in healthcare. If you're interested in AI outside of healthcare, this is probably not the course for you. But inside healthcare, there's a special set of skills you need to successfully implement AI. And that can be hospital executives, administrators, physicians, nurses, medical students. So there's a wide variety of people. This is not a coding technical course, so you don't really need a background in coding in order to take this. And you'll learn the big picture to be able to evaluate purchasing AI tools or implementing them. The program structure, we have 10 weeks for this program structure. And we have an interesting set of lectures here. We're starting off with the history of AI. Then we're moving into the intro to the AI life cycle. We're going to talk about machine learning and AI foundations. Clinical decision support is a big part of AI, and we're going to talk about how we can use AI for clinical decision support to help physicians improve patient outcomes. And it sounds like a simple idea, but many clinical decision support AI tools have not been successful. And based on our experience, we'll help you learn the nuances of moving down the last mile there. Large language models like ChatGPT are very popular these days, and they're very useful for some cases of reducing administrative burden. But they're not the solution to all problems in healthcare. And we'll show you the alternatives and where large language models can be used and where they're probably not ready for prime time. We're going to talk about robotics in healthcare. A big focus in this course is AI for improved health outcomes. So if we're not improving patient outcomes, we really haven't accomplished very much. It's nice to use AI tools for other purposes, but if we improve patient outcomes, everything else follows from that. Then we have a learning break, And then AI can be used also to prevent healthcare problems. So we talk about how it can be used to predict complications, but it can also be used to predict and mitigate chronic disease and predict complications before they happen and prevent them. There's a lot of talk about health data and ethics, and there are a lot of people that talk about this, but I think you'll see in this course, we have a solution. And the solution is good, rigorous science where we can measure, is the AI tool fair overall and for subgroups? And does the impact of it on patients result in fairness and equity? Change management and adoption. So it's easy to build these tools, but to get them used in a hospital and to get physicians to use them and to change the way healthcare is done is a major challenge. And we have decades of experience in working with healthcare leaders and frontline people to teach you how to do that. And finally, we have a live masterclass where Ian and I will both meet with you and answer your questions, and it will be interactive. So I'll turn it back over to you, Mohit.
Great. Thank you. Thank you so much, Professor Byrne, for taking us through the program structure and explaining it in detail. And I'm sure this was superbly helpful to all the candidates who are with us in the webinar today to understand whether and if the program makes sense for them, given their background, given their interest areas, and to get a glimpse of what to expect if they plan to join the program. With that, I will quickly move on to a couple of highlights of the program. So, in terms of duration and overall format, it's a 10 weeks long program, as we saw previously as well, and probably additional week or two for the master classes. But the core curriculum stands at 10 weeks, starting from foundations, going into machine learning, then various use cases, eventually ending with change management. So that's a 10-week plan. In terms of the learning format, it will be primarily be an online learning format with recorded video lectures from the faculty, with interactive live mentored learning sessions, and then 2 live masterclasses by the faculty. So the way it's delivered is in the beginning of every week, we release recorded video lectures from the faculty so that the learners can watch them, view them over the course of the week. And then over the weekend, there is a interactive live mentored learning session with an industry mentor where various case studies are discussed, various hands-on modules are discussed. So the idea is you learn from the faculty during the weekdays, and then you learn from the mentor the hands-on aspects, the implementation details, and of course, it's an interactive session where you can also get your queries answered and get to know more about how things are implemented out there. And then towards the end of the course, there are 2 live masterclasses by the faculty. Next point, live mentored learning, as I explained. So this is more to do about live interactive session with the industry mentors. Special care is taken to ensure that these are small group sessions. Typically, these are done in a group of 25 to 30 learners per mentor, and the learners are also selected in a way that the groups are coherent. So people with similar interest or maybe work experience are typically bracketed in a same group so that the kind of learning journey and interaction with the mentor can be more coherent. And the idea is to, of course, learn from the practitioners and then, of course, implement it and eventually develop higher order thinking skills as a result. In addition to this, you'll also get personalized learning support, personalized assistance with a dedicated program manager. So what's the role of a program manager? The program manager is like a friend to you, friend slash mentor, whose primary aim is to ensure that all the learners reach the finish line as they start the program, because it does get tricky at times. You might get overwhelmed, or you might need some extensions, or you might need some extra help to complete the course on times. And the program manager's main job is to ensure that they keep you on track and they help you finish the course on time. with all the projects, all the assignments, all the submissions, and whatever is required to for you to complete the course. As a part of this entire program and the way it's been designed by the faculty, it encapsulates plethora of uh, practical healthcare case studies with more than 8+ case studies across various domains, across various use cases have been covered in this program. And you'll get to know more about this in the video lectures that are released, and of course, they'll also be discussed in the live mentored sessions. So the course not just talks about the, so to say, theoretical aspects, but also delves into the case studies in terms of implementation or various use cases, and also the explanations of the same. So it's a balance of the conceptual learning as well as the hands-on aspects when it comes to AI in healthcare. Once you complete the program, and you'll get a certificate of completion from Johns Hopkins, along with continuing education units, which is the CUs, to demonstrate the amount of effort that has gone from a learner in completing the program. So you'll get both the certificate of completion as well as the CUs. In terms of weekly commitment, one should expect to spend somewhere around 5 to 7 hours per week on this program. Roughly, the breakup is uh, about 1.5 to 2 hours of recorded video lectures to be released every week, followed by about, again, 1.5 to 2 hours of live interactive mentored session. And then, of course, you should budget in 1 to 2 hours of self-learning time, to spend on case studies, assignments, quizzes, whatever the faculty has planned for that respective week. So that's how the program is structured. In terms of admission process, it's a simple three-step process. The admission is conducted on a rolling basis, and once we have the requisite number of candidates for a particular cohort, the cohort is closed. So the process, it's a simple three-step process. You can fill up the online application form present on the program webpage, and fill in the details around your work experience, your current job, etc. Your profile will be reviewed and by a panel at Great Learning. And if you're a good fit with the program, because we also want to ensure that you know the program is right for you and you are right for the program, so that eventually you can benefit from the same. So if you're a good match, the profile is reviewed and screened, and if it passes all the check marks, then you will be given an offer letter to join the program. And then, of course, once you receive the offer letter, you'll have to pay the admission fees to confirm your seat. For the next cohort is starting on June 7th, which is about 4 days from now. And there are, of course, a couple of seats left. So for those of you who are interested in joining this cohort, you should definitely reach out to the Great Learning team. You can leave your details on the program webpage, and someone from the team will reach out to you and will help you with the admission process. And there's also a phone number and an email ID on the screen. You can also send your queries here or get in touch with you can call the phone number. Someone will be there to get in touch with you, and they can answer your queries around the program, and of course, help you understand if the program makes sense for you or not. And there's also a QR code that you can scan to download the brochure. So with that, we've wrapped the agenda that we had for today, and we now open the floor for Q&A. I'll first quickly check if there are any questions in the chat window or in the Q&A window, and after that, we can, of course, take questions as they come. There's a question, and I'll read the question first, and then I'll defer it to the faculty for the answer. Um, so the question is that I can see the focus on patient care and AI use, which is understandably important, but uh, are we also focusing on the use of AI and medical research, as the main focus for this candidate is immunology and cancer in particular? So I'll defer this to Dr. Ian and Professor Byrne to answer if those ideas are covered. This is a question from Mahi. Sorry. Yeah, that's the question.
Well, unless you want to take a stab at it, Dan, I can address that. So I cancer research is of course broad as well. So I'm not sure if you're dealing with like pharmacology approaches, if you're dealing with factors that other factors that might deal with there's patient care, there's imagery, there's early detection, et cetera. And so what I have found is just being exposed to the analytic methods that AI present, right? It gives you a new approach to looking at data and looking at a large volume of data and data that interacts. I think one of the powers of AI is its ability to handle interdependent data. So one of the I would say weaknesses or limitations in typical medicine is I feel like medicine as a culture treats patients as independent and identically distributed. And it oftentimes, while we know that comorbidities are important and we know that there's a lot of interactions and we know that there's a lot of complexity, I think that oftentimes in medicine we lack the analytic tools to actually deal with those realities. And I think what AI is bringing is a powerful set of tools that help you do that. And I think we'll give you enough skills to either get started on self-learning that, or you might choose to take a follow-on course where you develop some of those technical skills to do it yourself, or you can at least better select a vendor that can help provide some of those tools for you. I don't know how well that addresses the cancer research question or immunology. I know at Hopkins I've done a fair amount of work with public health interventions, which I think is a little bit more along the lines of immunology, maybe not cancer per se, but dealing with like public health and infectious diseases. So like hepatitis C, HIV, STIs. I'm trying to think of some of the other ones. And so we understand that there are surprising factors that interact, and so I do graph analytics, so that's kind of where my area of specialty is, and so we've had some very successful models in doing that and figuring out how you actually roll out some of the innovations or solutions that we develop. I don't know if you have anything else you would add to that, Dan.
Yeah, I think there's lots of ways that a person working in medical research and cancer research could benefit from this course. One is the large language models and understanding how to use them and how not to use them. Many people don't realize that half the medical literature is wrong, and these large language models just summarize the right and wrong papers. It's a scientific debate. So understanding the limitations of AI, but where it can be used, I think is good. I think AI will be a part of your career no matter what you do. So just learning these skills and building it in and being a leader, the older people in your lab may not understand these. So the value you can bring is be the one who leads with AI. Also with cancer, it's got to start being personalized medicine, and it can't just be talk about personalized medicine. It actually has to be based on facts, and that's AI is the only way that's going to happen. For cancer, a lot of these cancers can be predicted much earlier with AI tools. For example, multiple myeloma, the prognosis can be improved with AI tools, and there are also a lot of false claims about AI being used in cancer and immunology. And I think this course will give you the skills to separate out, how to evaluate the claims that are real and the ones that are not.
Great. Thanks. Thanks, Dr. Ian and Professor Byrne for answering that. A couple of questions on cohort dates. So yes, June 7th is the cohort that is that is taking admissions right now. Yes, there will be more cohorts after June 7th. We've not decided the date. It'll roughly be somewhere either around July or August. We'll get back to you as soon as the date is final. But yes, there will be more cohorts after June. There's a question on mentor profile. So while it's a very diverse group, typically, just to give you some sense, we've had mentors who are chief data officers, AI governance specialists, AI consultants working at leading organizations. So these are some of the type of mentors that you can expect to learn from. Of course, these mentors are fairly seasoned experts in their respective areas and come with a lot of depth of knowledge, and will definitely add to the learning experience. I'll go to the next question. Uh, there are no prerequisites, so to say, for this program. Of course, it if you are coming from a healthcare space, you'll find it more useful than any other industry because the program says it's for AI in healthcare. But there's no prerequisite, so to say, from a program point of view. But of course, I'll defer to Dr. Ian and Professor Byrne to just maybe clear some air on what type of candidates might do well in this program, and yeah, if there's anything that people should brush up before they start the classes. I think that would be a better question to answer.
Well, our goal is to make this accessible to clinicians, executives, and technologists. So, technologists might be coming in with less medical knowledge and they want to learn how they apply their skills in AI to healthcare. A clinician might have a lot of healthcare knowledge and is wondering, hey, what can I do with AI? What is all this AI? How do I benefit? We're trying to address both of them and create that kind of mix and diversity in the course. So we don't really require any prerequisites from that perspective, and we'll kind of cover foundational terms, and then it would be on you to like supplement wherever you feel you're missing as we go through. But I don't think you should feel limited by any prerequisites. Maybe the only prerequisite is an interest in AI and healthcare.
Yeah, I'd agree with that. Everything I teach, I assume that people don't know anything, and I explain everything I need them to know. So you don't have to have a background in coding. You don't have to be a physician. I think hospital executives and administrators need to know these skills, and we explain it in a way that clinical and non-clinical people can use it. And also, there's a lot of people in IT that are not familiar with some things in healthcare. And really, that's what this course is about, is communicating skills from multiple fields to build a good team.
Great. Thank you. Thank you so much, faculty, for answering that. I'll quickly take a couple of questions. So there are no required documents, so to say, for the application, but of course, there are a couple of information that you need to share around generally your profile and why you want to do the program for us to review and make sure that you're the right fit. But there's no strict documentation required. Um,
Mohit, I'd like to just take the question
yes,
on.
please.
So two of them I think are kind of related. So one was asking about AI medical education training
Yes.
covered. We don't specifically talk about how AI advances medical education in the course. We're more focused on patient outcomes and maybe hospital administration efficiency, but I think probably a greater focus on patient outcomes. And then the other question about master's programs in AI and healthcare generally. So, we're evolving as this goes, right? But like, for example, the School of Nursing will launch, I believe, in fall this semester, an AI track in their School of Nursing for at least for DNP. So you can, as you're getting a doctorate nurse practitioner, you can also get a specialization in AI, which would involve basically the graduate course version of this course. And in AI, we don't have a healthcare specific focus right now, but that's something that we're working towards. So this is like the first step, and there certainly is a lot of AI relevance, right? So that there's a guy that a few of our faculty, as you can imagine, that teach AI. They do a lot of work in the medical field, right? So we have a lot of people that are doing research in like robotics for robotic assisted surgery, and we have people that are doing computer vision for reading radiology type reports and those sorts of things. And there's like I'm doing some work with large language models to help actually improve prediction of Alzheimer's. And so, like, we have a lot of people that work in this space. And so as we're building out courses, I think our next natural thing that Dan and I have been talking about is creating first a focus area. So when you get a master's degree in artificial intelligence, you can specialize or focus on healthcare applications in there. And then the School of Nursing has kind of stepped a little bit ahead of everybody in terms of getting their AI track. And I imagine the medical school will follow here somewhat soon. The other thing that I would tell you is if you take this course and you want to go further in AI, you can use this course for credit as one of your courses in your AI master's program. They credit that after you've completed the prereqs and the core and foundational courses for AI. So once you've been successful in the core and foundational, which is about 5 courses, then you can get credit for this course in your program and finish out with other, by that time, other healthcare related electives. So if you wanted to kind of use this as a way to see, hey, do I like Johns Hopkins graduate education? Do I want to go forward? Yeah, that's totally a path that we can make available for you.
Great. Thank you so much, Doctor. And I think it's fantastic that you mentioned that people can use this, as a credit if they want to eventually go into the master course. I think that's a big plus, and I'm sure that would help a lot of candidates. I think there's a question on a couple of people from specific backgrounds. So there's someone from uh, mathematical immunology and they want to know if this course would help them. There's someone from public health and they want to know how this course would be useful. So I'll probably go over others later, but these are the two that I could see. So if you can take this.
I have to think public health for sure. Both Dan and I have a background in public health, so I would tell you, we do have some like So bottom line is when you're dealing with public health, right? You're either dealing with almost like epidemiology, right? Like, hey, how does populations, not individuals, but how do populations develop disease? How do we design interventions that are effective? And so, I'm sure you're familiar with that in that background with compartment models and mechanistic models and empirical models. Well, what AI does is it brings a whole new set of analytic tools to that domain. And we remind people about the kind of core basics of public health and epidemiology, and the value of a mechanistic model and how AI can actually be integrated into that. What you also find is a lot of people with an AI background, they almost come naively into healthcare without understanding mechanistic models or the way diseases propagate, or they don't have a good understanding of what are the right health features to be looking at. And so I think when we add in the rigor of randomized controlled trials in with AI models, in with health applications, I think it gives you a much better treatment, in my opinion, of how that works. And lastly, I would say we share a lot of case studies throughout this course of real examples. And so if you're in public health and immunology, there's a case study, of course, on COVID. We can't do a course without talking about the good and bad of that. But we also have stuff on STIs. I would even think that some of the work that Dan presents on reinnovations or on clots or on readmissions, even though those are more clinical in practice, I think some of the insights you gain out of that will help inform the way you think about public health interventions and how you assess that. And if you haven't done graph analytics, right, or social network approaches to that, I have a teaser, and we could certainly talk more about that, going forward. So I don't know if you would add anything to that, Dan.
Yeah. So first of all, with medical education, I think one of the things that you can benefit from by taking this course is just take what we teach and teach it where you teach in your medical school. Medical schools really are hungry to include AI education in their curriculum. And there's not enough people to teach it. So you can provide great value by just learning what we teach and just promoting that same information. There are also limitations to using AI in education, large language models summarized in the literature. So it's important to be the voice of reason there. And students are already using AI. So, we're really catching up with students when we're talking about, are we going to use AI in education? So we need to catch up to the students because they're far ahead of us already. With public health, there's a saying that AI will not replace job X, but people in job X will replace those people in job X who use AI will replace those who don't use AI. And job X can be public health, it can be immunology, it can be radiology. So I don't really believe that AI is going to replace most jobs, but it certainly will replace the people that don't learn these skills and don't incorporate these skills into their job. Now, there are some jobs that I see it already replacing. So medical scribes, just a few years ago, there was a person who would sit with the patient and the doctor at a laptop and be the scribe. And now AI tools have really eliminated that job. But for most jobs, if you learn these skills and you're the voice of reason and a leader, and how to evaluate AI in healthcare, and how to implement it, you'll be successful. And the ones who resist learning this will be left behind.
Okay, thank you. Thank you so much, faculty members, for answering that. I'll take a few questions. So regarding the fee, I think the details can be found at the program webpage. The program duration is about 10 weeks, as we discussed. There's also a question on scholarships and discounts. So there's no federal scholarship or government grants that apply to this course. That said, there may be some discounts or small scholarships that folks might be eligible for. So when you speak to your to the catering team who's managing the admissions, you can check with them, and if there's any possibility there, they can let you know. But as far as the public grants and the government scholarships are concerned, they do not apply to this program. Um, I think there's also a question on difference between this and other programs, and I think Dr. Ian already spoke about it in detail. But what I would just like to highlight this and maybe then pass on to the faculty is one, uh, uh, the curriculum is completely designed and delivered by the faculty with recorded modules from them, which is definitely a unique aspect. Followed by the fact that there is live mentoring session almost every week to one learn more and second to answer queries in real time, and that support is something which is a very strong part of the program. Thirdly, the way this whole program has been designed with the different lenses, as Dr. Ian explained, starting from idea to testing to implementation using various use cases. I think it's a pretty unique offering in itself, and so far, at least, I have not come across a program that delivers similar level of outcomes. Uh, and yeah, so those would be the couple of highlights, I would say. And lastly, it also features masterclass with Dr. Ian and Professor Daniel themselves, which again, to my understanding, is a very unique value proposition, and to learn from the faculty themselves, to be able to interact with them, to hear from them directly, to ask questions. I think that's a unique experience that a program can offer. So that to me is a fantastic opportunity to learn from one of the world's best faculty. With that, I think the question on again, couple of folks from different careers, and I would defer to the faculty. So there's a question from someone with 25 years of nursing background wanting to know how this can be helpful, and there's a question from someone in the health informatics system background wanting to know if there's a relevant course for them. So I would defer to the faculty to answer this one.
Well, for nursing, I would say the fact that the doctor of nursing program and the School of Nursing at Hopkins is the first to create an AI track with their degree probably is pretty good evidence that there is great opportunities for career progression in nursing. I just have to say that I think nursing is like the most loved profession globally, right? Like everybody loves a nurse. My daughter's a nurse. My uncle's a nurse. It's a great profession. So I have to say thank you for what you do. It's probably also one of the most underappreciated professions. But I would tell you, in my uncle's case, as a nurse, he ended up going into IT. And he ended up finding, management of electronic health record data. He didn't have the benefit of AI. He's now retired. But that was back when electronic health records were new, and he made his career there, where I think he would actually work in emergency room, one day a week to keep his skills up. But he found a whole much more lucrative career and was able to really do a lot of great things advancing healthcare in that IT industry. And I think AI is going to be the same way. Some of the students that have recently completed, my AI business strategy course, we have nurses that work in payer and provider systems where they're doing evaluations of medical necessity, and we're finding huge opportunities for improving insurance claims and processing and evaluation of medical necessities there. I think AI is going to significantly transform that industry to lower healthcare costs in coming years, while adding, focusing those resources on patient value as opposed to administrative stuff. There's another couple nurses that work out in Seattle, in the University of Washington healthcare system, that are doing work around this idea of like how do we use AI to do charting. And there's of course some the benefit of charting is if you can automate charting, then you can maybe perhaps free up nurse time to be more bedside and more focused on patient care. But of course, then there's issues with AI in terms of hallucinations and fabrications and potential error that can get introduced. And so how do we ground those systems to make sure that they're effective? We'll talk a little bit about that. We'll talk about potential risks of over-reliance. So like all the nurses that have used, probably about a half dozen now that I've worked with that have used AI systems as the scribes like Dan was talking about. And they all identify that it identifies clinically relevant information and charting that affects patient care, at least some incidents, and they're all concerned about the over-reliance issue and what does that mean. And I think that's an open question, and so we need folks that are these domain experts that can speak both the AI language and the medical language. So I think these are opening up new careers and new focus areas, and it's really for you to define. So if you're a nurse with 25 years of experience, I think it's a great course to help. They need your leadership in this new field, in this new area. So I think that's awesome. And I think it's the same thing when you're talking about strategy, health informatics systems. How are you monitoring these sorts of things, right? Like we need to get, like, yes, there's labor specialization and new roles coming, but as we define this future, this AI enabled future, we need people that have deep domain expertise as well as technical literacy. We need both of these together in order to be successful. And so that's what we're trying to push forward. And I'm really excited to see all of you join, and hope you take the course and find as much value out of it as we have putting it together.
Great. Thank you so much, Dr. Ian, for answering that. I think we're at the end of the slot, so we have maybe one or two questions left. So if you have another 2-3 minutes, we can take those. Otherwise, we can close. Dr. Ian Preston-Byrne.
So I do have a little bit to add.
Sure. Please go ahead.
My wife is a nurse too, so I understand the importance of nursing. And I think it's great for nurses to take a course like this and be leaders at AI, because we know nurses really run the hospital. And one of the case studies is how we developed an AI tool to predict pressure injuries. And for 40 years, hospitals have been using this Braden score, which is completely outdated, and AI tools can predict pressure injuries and be used to prevent them. But nurses must lead these projects, these can't be imposed on nurses. The other thing I'd like to say is the difference between this course and the other courses is the instructors have a lot of experience. And we're just talking about healthcare. We're not talking about AI in other areas. The key thing that I hope that people learn from this is to know when we're moving the needle with using AI to help patients. And that's a key skill that is rarely taught. That requires skills from multiple fields. So, for example, overall accuracy, intention to treat, regression to the mean, these are rarely taught in other courses. So you learn these valuable skills that are essential to being successful.
Great. Thank you so much, Professor Bhan. I think we'll just take one last question and wrap this. So there's a question, I think linking back to Dr. Ian's statement on masters in AI. So can the credit obtained from this course be also used for PhD? I think that's a question that only the faculty can answer, so I'll defer to them.
I don't know the answer to that. I think it would depend on the program, but I just don't know the answer.
Can you say that one more time? What was the question?
The question is that can the credit obtained from this course be also used for PhD? Because I think previously we said it's used for, it can be used for master courses. The question is that if it's applicable to PhD as well.
I don't know if that determination has been made. So I do know that that in the AI master's program we've made that determination. I would imagine that the AI master's program gives credit for their course, that I would imagine like the DNP program would, and that maybe other other programs at Hopkins would be willing to do that. What we don't do is you won't get like a graduate credit for this course that you can transfer to another university. It is more that the AI program will acknowledge it, and potentially, you can certainly reach out to me about computer science, cyber, information systems, AI, data science, and robotics. All might all probably would give some credit towards this course at Hopkins. And again, that credit is added to the transcript once you've completed the core course, which is like 5 courses. So 10 courses for a master's degree. The 5 courses, if it was AI, for example, would be like, algorithms, machine learning. There's a generative AI course, AI-enabled systems, which is taught by a brilliant faculty that's done a lot in radiology and in computer vision. And I'm missing one. And then then of the 5 electives, you'd have one credit, one of the electives from this course. So if that makes sense.
Great. Thank you so much, Dr. Ian, for answering that. And with that, we'll close the webinar. We're already a couple of minutes over the designated time. Thank you so much, Dr. Ian, Professor Byrne, for joining us today and helping the participants understand more about the program, its design, the design thought process that has gone into it, and answering the questions in so much detail and with so much patience. It was wonderful having both of you here with us to know more about the program, to answer more about the program. To all the participants who joined, thank you so much for joining in. We love talking to you, and we hope to see some of you in the upcoming cohort. We hope this was helpful and helped answer your queries. We understand that you might have further questions. In that case, please reach out. Please share your details on the program webpage for this program, and someone from the Great Learning team will reach out to you and can help answer your queries. With that, we will close the session. Thank you so much, everyone, for joining in. Have a great day.
Thank you.
Thank you.